Hi everyone, I am Dr. Ramesh from Sasson Lifeline Veterinary Hospital. Today I have a very interesting case. This is not related to surgery and all. This case has presented to us with inappetence, vomiting for last 1 month on and off, and very weak. His albumin was very low. His intestine were very distended, gas filled intestine completely. We have done his abdomen scan and we found that lots of fluid in the chest cavity, in the abdomen cavity, and his liver was very enlarged, and his all the loops of all the loops were distended completely, intestine loop, and there was a distinct material was sitting in the stomach also. So we decided to do a CT scan before that, and before CT scan we removed almost 2 liter of the liquid fluid from the abdomen cavity, and that fluid in analysis came as an inflammatory transudate only, and it was mixed with the blood. So we were having suspicion of tumor, rupture of liver, or the bleeding also, and because of low albumin probably the dog has started getting ascites, and then probably ascites becomes blood mix later on because of the inflammation. So we have done the CT scan. This is a plain CT scan I am showing. So I am going coming to the from this is the heart and this is the chest cavity. This dog is having megaesophagus, most probably because of the anesthesia, and there is lots of barium is sitting inside. Because this dog is we have given barium to this dog, and if you see the stomach, the barium is there in the stomach, but this area there is some cloth kind of structure is there. That's it. When we removed this was a socks was there inside. He has eaten a month before this socks, and it was there in the abdomen, and his liver was very enlarged. So if you'll see, because of the contrast, this area is very hazy, but this is his liver completely, and these are intestine loops are there, multiple loops are there, very big loops here. But if you see this liver lobe is coming till the area where the bladder is there. So bladder is starting here and this lobe is finishing here, and these are all intestine loops, and the intestine loops diameter is bigger than the vertebral diameter. So looks like maybe we are dealing with the obstruction also, and there's something is going on with the stomach also and the liver. So if we don't give contrast agent and don't do contrast CT, sometime we will not be evaluate this kind of cases very well. So then we have done a contrast CT of the same dog. We have given contrast agent, and then we have done the CT scan. And in CT, in contrast CT, so you can see that this is a gallbladder, and this is the liver which is having good blood supply, but this part of the liver is not having any blood supply. This is the stomach. Again, this part of the liver doesn't have any blood supply. Other part is getting the blood supply. This part is not having much blood supply again. And the same liver lobe is going beyond this point, and again it's not taking any blood supply. Completely, this lobe is completely out of blood supply. So that means either there's a blood clot is blocking this blood supply, or something else is going on. Probably the torsion is going on in this case, and which is liver lobe torsion, which is very rare condition. That's why I wanted to discuss this case. Another case, another finding we have found in this case is because intestines were distended, and none of the material was going beyond one point, and that point was here, this area. So the large intestine was completely empty, and the small intestine, this is all small intestine which were distended, and this is the cecum. So cecum is here, the large intestine is starting here, which is completely empty, and the small intestine is trying to go inside. So there may be a ileocecal junction stenosis is there, where there's a lots of tissue formation happen, mucosal tissue, and usually I've seen in large breed these multiple cases, and these are chronic cases. So when we opened this case, we removed his socks from the stomach, then we have removed, we found that there's a severe stenosis at ileocecal junction, and we have to rectify that. So we have done a plasty in that area in such a way that we have made that opening almost 6 times bigger than the opening which we get. And then we found that this liver lobe was having torsion. So in this case, most probably how I can feel a pathophysiology has happened, that this dog must have eaten the socks and stopped eating properly, and because of the stenosis as lumbosacral area, he wasn't getting complete appetite and the digestion, and his albumin has gone down. And because his albumin has gone down, it was a long-term case. He must have got the ascites, and because of ascites, probably his liver lobe was completely floating in the ascitic fluid and may have got torsion. So in this case, this could be the reason of torsion. With all these two problems, we can correlate together. So sometimes if something is happening in younger dog where we are not suspecting tumor, something else can be found also, and which is a rare condition for me also. That's why I'm just putting this CT scan. So we have removed liver, in this case liver lobectomy we have done. We have removed the socks and we have rectified the ileocecal junction stenosis, and the dog is fine, doing very well right now. It's almost 7 days after surgery. So this is how we diagnose these kind of cases, and we try to treat it as much as possible. Thank you for watching this video.